One.
Good morning, one and all. This is Dr. Sudarvili, Associate Professor, Department of Biomedical Engineering, KPR Institute of Engineering and Technology. I am here to introduce a new topic for today, which is QIC accreditation. QIC is nothing but Quality Control Committee accreditation. This is basically it's required for all kind of organizations. Today we are going to deal with healthcare. How this QIC is placing a very vital role means every particular organization need a third party inspection, which means if everything is going with of top notch quality, we need an external audit and review to acknowledge it. So this is one such committee called as CQI. CQI is nothing but continuous quality improvement. Everywhere when the CQI is fixed, we will be having no assurance for any flaw. CQI, as I told previously, CQI is continuous quality improvement and it is a process. Systematically it is done and intentionally to improve the resources. We have two types of resources in healthcare. One is the patient safety and the second is utility. In patient safety we have services like clinical services and laboratory services, blood bank. And in utility we have equipments. We have various equipments of diagnostic and therapeutic. In all the equipment we are supposed to do maintenance, troubleshooting, and we have to go for servicing. Here we have CQI. The second point is once the CQI audit is over, definitely we can expect some positive outcomes from such organizations. And CQI is very proactive and totally it is ideal. Why do we even need CQI is a question which comes to our mind. Because you have many corporate reasons. For example, we are serving the healthcare community. It is a large sector. So once CQI committee approves that particular hospital, definitely many customers, for example, the patients will visit the hospital if it is CQI accredited. And you have something called as insurance providers. For example, when we take Royal Care Super Speciality Hospital in Coimbatore, if it is CQA accredited, obviously many patients will come and visit and many insurance providers will suggest that hospital. So this is one of the key reasons. Certain care reasons means once we have this QIC accreditation in CQI, we will be having very less risky because they will identify and they will eliminate and they will minimize all the wrongs going inside the organization or hospital. They will improve the care, they will reproduce the quality. And how the CQI and PDCA model is introduced. Now I will introduce the PDCA model and then I will come back to this slide. This is what is PDAC model. What is PDAC model? Plan, do, check, act. First we need to have a quality plan. For example, we are taking a nebulizer as an equipment. For that equipment we need to have a careful plan. How to maintain it, how to service it, how to troubleshoot it, we should have a careful plan. Once the plan is executed, then we need to do all the rituals over that nebulizer. Once the doing is done, we need to check for the clarity and corrections. Once the error has been completely minimized, then we should go to ACT rule. ACT is nothing but implementation and incorporation. Now I will explain how CQI and PDA model is being completely relevant. In CQI, the accreditation committee is giving the evidential proof that this is under the quality control. Then what this PDCA model is giving, that is giving reaffirmation. Yes, that model is 100% following the accreditation in quality. We will be having review journals, we will be having PNP journals, peer-to-peer journals, and they will be having interview with individual stakeholders, which we will be having with staff, even with stakeholders, with all the consumers. We will be having individual interviews. The external panel will conduct this interview to confirm it. Then this, as I already told about the plan, do, check and act model. About this, you have so many other quality gurus. One such quality guru is Joseph M. Juran. What this Joseph M. Juran is telling is, he is making a triology concept. Beforehand, this Joseph M. Juran is a father of philosophy and father of quality management. He has published a book in his name, Mr. Juran's Philosophy. He was born in the year 1904 in December 24 and is graduated in Minneapolis, South India School in 1920, and he has a bachelor's degree. He earned a bachelor's degree in electrical engineering in the year 1924, and his contribution is very massive in quality management. According to him, quality is nothing but customer satisfaction. If a product satisfies the needs of a customer and the demands of the customer and he is very satisfied with that particular product, then he is done for the day. Then quality is also nothing but freedom from deficiencies. It doesn't have any errors, it doesn't have anything to correct. And the customer is completely happy means that's it, is a quality. As I told before, Juran's trilogy is a very famous book which is published by Juran, and it is a famous workable model. Before Juran, we have someone called as John Deming. Deming's model is a failure model because there we have 14 different points which to follow. Either one or the 2 points, if it is failed, then completely that particular organization or firm will be into loss. But this trilogy concept works well. It has 3 concepts. We need to plan, we need to improve, we need to control. What is all about planning? Juran's trilogy accepts with these 3 quotes. What is all about planning means, when we have a vision, we need to develop our organization to next level in this short duration or long duration, we will be having a goal. So first point under planning is we need to set a goal. And we need to identify who is our customers. For example, if it is of healthcare, our customers are patients. If it is a working institution like mine, my customers are students. I need to know who is our ready customers, whom we are going to serve. And next comes the needs of the customer. For example, in healthcare, quality accreditation in healthcare is my topic. In healthcare, basically the customers has different needs. They want to have good report at the right time, good medication, good service, good quality patient care, so many expectations from patient side. We need to address everything, needs of the customers. Next, we need to develop a model which responds to all the needs, almost all the needs. It should be cost friendly, time friendly and eco friendly as well. And we need to develop the process. So it should not be a time consuming thing. If the patient is made to wait for 5 hours to avail a service, then it is a poor management. Time is a very important constraint. We cannot make the process to extend. Finally, we should establish the process to work for all kind of operating routes. From manager to clerical staff should understand the routine of the plan from morning to evening. Second thing is, as I told about quality control. For example, if everything is done, if nobody is there to control or check or validate, definitely we cannot come to some evaluation. So we need to have the valuation committee or evaluation troop. This evaluation troop, what they used to do is, they will evaluate every performance of the equipment as well as the staff personnel. Everything they will be evaluating using a appraisal performance. In our institution we will be having appraisal. Like that in healthcare they will be having the performance of every equipment using calibrations. They will be comparing the actual performance with the quality goals which is being set in the planning. They will act on the difference. This is what is the main thing, which is quality improvement. Once they find in the checking it is not in the improved phase, they will readily eliminate or throw the particular content into the dustbin, because they will never put it in the market. If supposing they are bringing the product to the market and it doesn't meet the challenges of the customer, that will be a poor model. So during the improvement stage itself, they will try to discard or decline the particular orders. Once they find the thing is working out well, then they will diagnose and control the gains. According to me, the Juran's trilogy has so many strengths. One particular strength is completely customer friendly. As we say, in the institution we will go to next level when we satisfy the students. It should be student friendly. Likewise, if our product is customer friendly, that is the biggest strength is what Juran is trying to say. I also usually agree with this concept. And in the next stage, the maximum massive benefit is for the organization. If we satisfy the customer, obviously who is a good benefiter? The organization or the hospital. What is the weakness? Main weakness is somehow the labor force is not in control. For example, we were given so many leverages to the staff and employee, means this model will become a failure model. Because we are checking the need of the customer and we are supplying from the organization. In between there is something called as workforce and labor. If we are not controlling them, definitely they will put the whole system into a failure model. So that is the biggest weakness. Then here few of the quality programs are not transparent. The organization or the management not ready to be so transparent with the employee and students. They are keeping something in their own. It's called as quality manual. Quality manuals are not shared to the level of employee. Next comes the Kaizen technology. We are going to describe, or we are going to find the contradictory between the Juran's model and Kaizen's model. What Kaizen say? As we all know, K is nothing but the changes, or we can make the action to correct the wrong one is K. Zen is nothing but good. We have Zen philosophy. What Zen philosophy says is, whatever for good, we can think good and do good. So Kaizen is all about make a change to do the good. So Kaizen is a small incremental change. Here you can see it in the symbol itself. These are all the Japanese symbols, and here comes the meaning. A small change is done for the good and better cause. Everyone should follow, every day they should follow, everywhere they should follow. So this is what is a model. Thank you.